Well, the Trading Bell team has just arrived here in Upper Hill and we are at the NHIF building. And right behind me is the man of the moment. This is Dr. Peter Kamunyo, CEO of NHIF.
Karibu Abu.
And we'll be having a great discussion on just what the fund is all about and what does the future look like for the NHIF. Thank you, Daktari, for joining us on the Trading Bell show. First time on the program. Welcome.
Thank you very much, Ben, and it is indeed a pleasure for me to be on the show.
All right. And we are in a pandemic period as a country, as a world, and our healthcare system has literally been exposed when you look at the number of admissions in hospitals and the overwhelming cases that we are seeing across the country. And this literally tells us that we need to go back to the drawing board. Perhaps just give us a sense of how has the NHIF performed in this pandemic period? What are some of the learnings that you have picked? And of course, the successes.
Yeah, thank you. Actually, in this case, with the pandemic, as with everyone, it was totally unexpected. It was a surprise, and everyone was literally guessing about what is going to happen next. We've seen what is happening with the global economy, even including the Kenyan economy. But for us, I would say it had very interesting insights and outcomes. At the onset, after COVID was declared a pandemic in March 2020, all systems literally crawled to a stop.
Yeah.
And we're looking at how do we deal with, first of all, the staff who are delivering the services, and also what is the reaction and the impact on the promise that we give in terms of healthcare. But as we progressed, there was increasingly interesting changes. First of all, the social fabric was broken. So even for people who are going to hospital, because Ben, remember that even with the pandemic, COVID pandemic, also other illnesses were still going on.
Sure.
So people were still going to hospital, having to go to hospital, though the numbers reduced. But at the same time, the social fabric of support also started crumbling because of the lack of gatherings, etc. Mm-hmm. So we actually noticed a very interesting trend. As businesses started closing down and support for Harambes and all that was dwindling,
yeah,
we noticed that the voluntary membership actually, after the initial dip, started going up. In fact, in that year, we got a total of just over 540,000 new voluntary memberships that joined the fund.
Yeah.
And we had predicted after the first and the second quarter that we're going to perform dismally. But what we have seen is that with the pandemic, there was also increased awareness of health and the need to have that protection. So a lot more people joined that previously were not there, which was a very interesting finding. Of course, because of the other protective measures, we
Sure.
also noticed a trend in drop of especially communicable diseases like diarrheal diseases, respiratory tract infections, apart from COVID, of course, reduced. And all this, in a nutshell, translated into us closing with a slight growth of revenue of slightly over 61.9 billion compared to the previous year of 60.8 billion.
All right.
But also on the claims, we had a slight increase of about half a billion from about 40.4 to about 51.2.3 there. Mm-hmm. So it was an interesting finding, and I would say that even up to now, we are still learning how to live in the new normal with COVID.
All right. Very interesting opening remarks there, Daktari. And for many Kenyans who perhaps are having different thoughts about the NHIF, of course, the image is very clear to majority of them that the NHIF has been embroiled in all manner of issues, from scandals, and the face and image of NHIF is actually tainted. Walk us through literally How do you reform such an organization? And of course, give us a sense of how significant is the NHIF in terms of feeding into our healthcare system?
Yeah. NHIF, to start with, is a 55-year-old institution. When NHIF was formed or established in 1966 as a department in the Ministry of Health, the primary role at that point was to provide medical cover for civil servants then. And you know, it was just shortly after independence. But very quickly realized that it would be a vehicle for providing a platform for cushioning Kenyans against medical expenses. So in 1972, voluntary membership was allowed. And from that time, voluntary members were allowed to join NHIF, contribute, and be able to get the benefits. The benefits from then were pretty simple. It was bed rebate, that you go to hospital, you're admitted, and it's reimbursed per day, a fixed amount. And way back then, that amount was sufficient to cater for the entire hospitalization. But however, as we advanced with time, the costs of care, as you are well aware, have been continuously increasing. The sophistication of treatments, which also increased the costs, and these costs continue to grow. So come 1998, NHIF was transformed to be a parastatal, so that now it has its mandate to be able to be more creative in terms of delivering solutions to meet the growing needs of the people of Kenya. And with time, as even the contributions increased and the rebates for the hospitals increased, a major turn in terms of providing comprehensive benefits happened in 2015. And in 2015, that's when we introduced outpatient covers, and also at the same time introduced packages to address the growing health needs of the people. And some of these packages include the dialysis package. And remember, His Excellency the President, during the last Madaraka Day celebration, actually gave that as an example. And things like the cancer package, things like the radiology package, where you have your MRIs, your CT scans done, things like road evacuation across the whole country, packages like for drug rehabilitation, surgical packages. So all these packages were introduced in around 2015, including outpatient services. So from that point, even our operation became more sophisticated, because now we are dealing with different packages and different models of reimbursement. Because for outpatient, to cater for all the 10.7 registered families, you need a model that you can be able to handle that paperwork. So as we progressed and we've had our learnings, because that was the first time, we got challenges. And I think the biggest challenge we got, and was a great shock, was in the year 2018, 2019, where we made the first loss as a fund. And that loss, Ben, was spectacular. It was a 3.6 billion shilling loss. So you can imagine, from a point of surplus to a point of 3.6 billion shilling loss. And it is following that we realized that we must reform the institution to ensure that it remains sustainable because of the role that it plays. Because as we proceed with all those number of lives, we handle about close to 1 million patients per month. That is a great impact on the people of Kenya. So in 2019, there was a panel that was formed. It's called the Healthcare Financing Reforms Expert Panel, HEFREP, and came up with a raft of recommendations. And these recommendations were to ensure that those challenges that had arisen with a change of model, which is expected, that we are able to manage that so that NHIF can continue to stay in its place in providing access to the quality, affordable care for all Kenyans. And at the same time, be a strategic purchaser of healthcare in this country, in our journey towards universal health coverage. So of these reforms, which were about 55, I'm happy to say that majority of them we've actually been able to address. Just broadly is like the digital transformation, for example, because if we're dealing with such high numbers, if we're getting to universal health coverage, we're talking about a huge volume of transactions, huge volume, which require real-time also intervention. Because if someone goes to hospital and it's an emergency, requires urgent surgery, you need the communication to be able to come to NHIF and the pre-authorization given in real time so that treatment is not delayed. We're also talking about the high volume of claims. You want to ensure that the claims are reimbursed in good time.
Yeah.
Because if we are talking about payment of claims, of benefits of in excess of 50 billion a year, we're talking huge amounts, and that cannot be done on paper. So our digital transformation to ensure that members have quick access through the biometric registration, through electronic claims, that is part of it. But also at the same time, you know, in a team, in an organization, it is the people who drive it.
Yeah.
So the organizational transformation was also one of the key reforms to ensure that we also align the skills of the staff with the tasks at hand, to ensure that we've aligned the organization with the emerging trends in healthcare financing to ensure that we're able to take the organization and position it as a strategic purchaser of health, not just at local standards, also at international standards. And then finally, to enable all that, we need progressive legislation, because moving from a point where we were just doing reimbursements to the sophistication that we have now, we need to have legislation that is supportive.
Talk to us about the impact the biometric switch will have, especially in tackling cases of impersonation, of course, cases of fraud, and how much will you be able to save through this?
In the last couple of weeks, you may have noticed that there are a couple of either healthcare institutions or individuals who've been arraigned in court, having been caught either impersonating or manufacturing claims. In fact, one of the recent ones is unfortunately that type of impersonation, and then unfortunately the person passed on. So even the person who had given out their card, now on record, it looks like they have passed on. And this issue of medical fraud is rampant, not only in this country, but also globally. In fact, a study done by Duran Institute showed that about 30% of medical claims tend to be fraudulent or is waste. Now, coming back home, we would estimate the fraud to be anywhere between 10 and actually 30%. So if you look at what we are turning over in terms of payment of claims, it's easily slightly over 10 billion shillings annually in terms of fraud. So this is a significant amount. And medical fraud occurs in different forms. You mentioned the first one, and that is the easiest one to do, which is impersonation, whereby I give you my card, you go and get access to care. And one of the digital transformation that we're doing, the biometric registration, will be able to curb this, because what is required now is you register all your digits, all your fingerprints, and actually we are using all the 10 fingerprints will be registered. So when you go to hospital, you'd be able to access services with using any finger. And the reason we're using all the 10 fingers is accidents can happen that you don't have. There are also people in certain professions that is difficult to capture their fingerprints and all that. So it's to ensure that there's access. So our primary actual intention is that you as a member, you have quick access. But at the same time, is to ensure that it is you, our member, who is getting the service, and not somebody else that you're helping, your neighbor, your cousin, your brother, your sister, etc. So that is one in terms of the transformation. The other way that you see fraud happening is manufacturing of claims. And this tends to be driven now from the healthcare providers, where they get cards, etc., and just write out.
Collude, yeah.
They collude, write good paperwork, and on paper, or it looks like it's a valid claim. There's also upcoding, whereby you go for a small surgery, for example, but it is recorded as a major surgery or specialized surgery, for example. So, or keeping patients in hospital longer than they need to be, which I'm sure you have seen in the news.
Sure.
So to reduce that, that's why we also introduced the electronic claims system. And the electronic claims, we went live countrywide on the 11th of July, just about 2 weeks ago. So what this will do, because it's also an advantage to the healthcare providers, is that their claims will be paid faster, because once a patient is seen in real time, the claim is transmitted to us.
Sure.
So it will reduce also the challenge that you've been hearing about NHIF delaying in payment of claims, etc., etc. But also at the same time, we will be having a real-time record of the encounter in hospital. So we'll be able to have our clinical team be able to intervene, help and guide in good time, do the pre-authorizations a bit faster, based on that electronic claim. So that will really help to also reduce that fraud that we're seeing, but also at the same time increase efficiency in terms of member access and hospital reimbursement or claims payment. Then also within that, in terms of access, because previously, Ben, you'd be the principal member, for example, and if anyone in your family needs care, you need to either take the card to the hospital, etc. This time, we are doing a biometric registration of all the family members. So you, your spouse, your dependents will all be registered. So should they have a need to go to hospital, they can actually
You don't need to be there.
You don't need to be present, and they can access care.
Brilliant. And of course, all this, Dr. Mayo, is geared towards onboarding more members.
Yes.
And looking at the scale and size of the reforms, we also understand that this matter is also at the parliamentary level, where there's a bill that seeks to convert now NHIF into a health insurance fund. How will this impact on operations? How will this better services to members? And of course, what does this portend really for the fund into the future?
Yeah, thank you, Ben. And maybe a correction is not even to convert NHIF into a fund, because NHIF, as its name is National Hospital Insurance Fund.
Yeah.
It is the vehicle through which we're going to scale up to achieve universal health coverage. So the legislation that is there is to be able to enable that to happen. And some of the key highlights in terms of the legislation is that one that obligates all Kenyans who can pay to pay, and then those who cannot pay to be identified and supported. And that the government has already taken the first step, and that which is also one of the big four agenda of His Excellency, the President, Uhuru Kenyatta. And in terms of identifying those who cannot pay, the indigents, those who can't afford even basic necessities of life, including health, through working with the Ministry of Health, working with the Department of Social Protection and the county government, we've been able to identify the first 20% of the 5.1 million indigent families identified in the country. And we have currently registered them in our system and are awaiting disbursement to have them active. So this is the first step to ensure that we are able to cover those who cannot be able to pay after they've been identified. The other one is also to ensure that the corporates also match what the employee contribution is. Because to be able to achieve UHC, you need to pool resources. everybody has got to get their skin in the game. And even globally in all countries that we've been able to achieve UHC, corporate participation is mandatory. And like in our case, if you look at the contributions from the statutory or the formal sector, the contributions actually start from 150 shillings all the way to 1,700 shillings for the higher paid people. And majority of the people actually pay from their pocket, because it's contribution of the employee, less than 1,000.
Yeah.
And close to 15% actually pay less than 500 shillings a month, which is even less than what the informal sector is paying, what Mama Mboga is paying, who doesn't know whether they're even going to earn a shilling that day. So making sure that there's that matching contribution will help to cushion. And like I told you earlier, after the loss of 2018-19 of 3.6 billion, in 1920, with the measures that we have put in, that loss actually reduced by 2.5 billion to 1.1 billion. Mm-hmm. And in the last financial year, we were able to reduce that loss further to only 200 million. So that means from the spectacular loss for the first time to now, we've been able to reduce the loss by 94%. But we must be able to make this sustainable. And to be able to make it sustainable is why we need those laws. The other laws is also to encourage people to stay on. So the penalties previously were very punitive. I mean, from 2 times for the corporate members, penalty, even 5 times for individuals. So in the new law, that has been reduced to only 25%, penalty of 25%, from 2 to 5 times to only 25% of them. And that will encourage. So when something happens, we know there are harsh economic times. I might get a blimp here or there, but you're able to catch up and be able to join the rest. But also in the same vein, we've also increased the penalties for fraudulent activities, so that to make sure that it acts as a deterrent to prevent those individuals or organizations that are hell-bent to steal from the Kenyan. So that is also contributed in the bill. So it's a whole raft of changes that are meant to encourage us and drive us towards UHC.
Interesting. And as we wrap up, Daktari, I'd like you to just give Kenyans the assurance, because there are, of course, the underlying issues that have bedeviled the fund, and the reforms and the digitization is all part of the transition towards safeguarding the contributor funds. And I'd like you to just look at Kenyans straight into the camera there and just give us your parting shot. Why should they be concerned about being part of this great transformation journey in regards to universal healthcare?
NHIF is there for you and has been there for you for over 55 years and will be there with you continuously. NHIF will carry you without any exclusions of age or ailment to enable you to get the access that you need without suffering financial hardship. 1 million Kenyans become poor every year due to high cost of healthcare. And NHIF is there to support you to ensure that you're able to get the care that you need from all our 8,000 accredited and contracted facilities countrywide. So we urge that all Kenyans who can pay, and to pay consistently. And then for us to identify those individuals who cannot pay, and for us to support them, as the government has also taken the initial initiative to ensure. And this has been done through even the previous health insurance subsidy programs for elderly, the disabled, the orphaned and vulnerable children, and also Linda Mama, which came in to help very many people during the pandemic period, because even the Linda Mama claims actually increased, helping those mothers who did not have access to proper delivery.
All right. Brilliant place to end the conversation. Thank you so much, Dr. Peter Kamunyo, for speaking to us on the Trading Bell. And that's why we want to bring it to a close on this week's edition of the Trading Bell. Interesting insights around the healthcare in the country, and the transformation is underway. For us, it is to wait and see how this will impact our society. On behalf of the entire team, my name is Abi Agina, and until next time, keep it locked here on KT News. And remember to always engage with us on our Twitter handles appearing at the bottom end of the screen.